everyone. Thank you all for attending this webinar. We're going to go ahead and get started. My name is Steve from Kaleido. Before we do that, just a couple housekeeping items. The first is this call is being recorded, and we will make this recording as well as the slides available to you after the webinar through an email follow-up. There is a Q&A button you'll find where you can ask questions. You can do that at any time during the presentation, and we've reserved some time at the end. We'll get to as many of those questions as we can. Welcome, and from wherever you're tuning in from, I hope you're well and safe in this challenging season that we're in. And the topic today is a timely one. We're here to talk about digitally transforming healthcare with blockchain. And to do that, we have we've brought a lot of firepower to this conversation today. I'm thrilled that my co-founder, Sophia Lopez, will be participating. She's been in the enterprise blockchain space since 2015 and brings a lot of unique experience. Heather Flannery is joining as well, our partner at Consensus Health, where she's the founder and CEO there, and has both deep blockchain expertise as well as deep healthcare expertise. And also welcome to Jamie Kurtz, who's the CTO at Diagnotes, and he's going to be sharing a little bit about his solution and also how he's powering that on Kaleido on AWS. So always interesting to see an actual implementation and hear directly. And then finally, Lana Kalashnik, a good friend and a luminary at AWS, who's really helped launch AWS's blockchain practice and is a lead there, and she'll be sharing as well. So a quick look at the agenda before we dive in. Heather's going to kick off talking about trends in the healthcare space overall, and then zoom in a little bit into blockchain and healthcare, and turn it over to Sophia, who's going to tell you a little bit about how some customers are using Kaleido to power those blockchain healthcare projects and solutions. And then Jamie's going to walk you through Diagnotes, and we'll go back to Sophia to walk you through a demo. Always fun to see a demo. And then Lana's going to bring it home for us, talking about AWS and some of the solutions available in the healthcare space there. So without further ado, I did want to introduce the three solution providers, technology providers here on the call. Very, very strong partners. AWS, who really needs no introduction at all. They're a world-class industrial grade infrastructure and services, are powering many industries, including in the healthcare space. Kaleido, we are an infrastructure play as well. It specifically focused on helping you to modernize your business network and using decentralized technologies like blockchain to do that. And our partner, Consensus Health, who is very much focused in this vertical and bringing cutting edge solutions and technologies to you in both blockchain and machine learning. And you'll see more and hear more from Heather in that space. So Heather, I'll turn it over to you to start with current trends in healthcare.
Thank you so much, Steve. Hello, everyone. It's an honor to be here. I'm Heather Flannery, founder and chief executive officer of Consensus Health. We're all gathered here today because experts in the industry, as well as every human being on planet Earth who is also a patient, recognize that healthcare globally is replete with challenges. It's interesting. It's an industry segment worth more than $10 trillion in total economic volume globally, yet somehow presently fails to meet the needs of all of the stakeholders. No matter which category of stakeholder you're describing, there are long-standing, extremely challenging, unmet needs to be fulfilled. For example, in the US market alone, we have more than $200 billion a year in acknowledged administrative waste. We have fraud and abuse throughout the world in developed and developing health economies. There are substantial challenges in a number of areas also that may not be obvious, and that is that as healthcare expenditures have continued to climb, it's interesting that the proportion of those expenditures that are spent on actual physicians, for example, has not really climbed much at all, where the expense of the total administrative burden of delivering and paying for healthcare has exploded over time. Even as value has been derived from the digitization of healthcare, moving away from paper-based electronic health records, for example, so too have unintended consequences been realized. New problems have emerged. For example, when I started in the healthcare industry, which was in 2005, about physician suicide was not an issue. It was not something anyone would ever have thought would be an issue. But there are unintended consequences and dehumanizing elements to mechanizing what was as much art as science. And now we have really radically diminished provider experience as a net new category of problems. Bioethics, an incredibly important field, has not received an upgrade at all since massive technological change has altered the way that we access, utilize, and apply health information. Cybersecurity risk has increased increased as we have digitized. Healthcare and life sciences is now the most attacked industry sector in terms of large-scale cybersecurity threats. And it's so much more than about identity theft like it was a few years ago. Now, as medical devices and health information systems run everything from life support systems all the way across the board, cybersecurity vulnerabilities are no longer only an economic threat, they are a potential threat to life. Privacy, we as citizens of the world have, through regulations like GDPR, like CCPA in California and others, have expressed a collective intent to return to a model where data is more directly owned and governed by individuals. Nowhere is this more significant than in healthcare and life sciences, where our data is the most intimate data. It's also it causes us to have the highest levels of vulnerability if that data were exposed. And granted, all health information is not treated equally from a social or psychological perspective, but it is treated equally under the law of every jurisdiction. So the data that exists in silos really has those reasons are compliance burdens for those silos, as well as competitive dynamics depending on what market. So we could move to the next slide. And the next. So looking at how blockchain and emerging technologies could be applied to this field really connects directly to those compliance burdens. For folks that are new to the healthcare industry, it may be unintuitive to recognize that things that you think automatically are obviously good things from an ethical perspective, from a moral perspective. Oftentimes, the highly complex regulatory environment and the compliance boundaries mean that those things that seem so intuitive are actually substantially out of reach. So with the application of blockchain technology to such a complex industry, it has to be broken down into stages here. And I developed this PHI readiness framework as a way of expressing stages of transformation of our industry that involves blockchain and converging innovations. So we are presently, in my view, at the end of stage one. And PHI, by the way, stands for Protected Health Information, which is a defined term in the US law HIPAA. But every jurisdiction has a similar definition of what is health information and how is it regulated. We're presently at the end of phase one, which means we are seeing blockchain use cases in our industry that do not involve the use of any PHI achieving scale. And examples of those are things like supply chain, as long as you don't include it all the way to the point of care. Provider directory, where you have completely public information in a scenario where data quality and integrity and access was a major issue. So that has taken off. There are a wide range of non-PHI dependent use cases, many things throughout the revenue cycle, et cetera, that are taking off. And for a moment, I'm going to skip phase two and go over to phase three. Phase three is really the holy grail of all of the major goals and objectives in our industry that we've been striving for toward many years. Things that are prohibited due to information silos, regulatory complexity, the business structure of how the industry works. So some examples of those things are finally being able to coordinate care of a patient across organizational boundaries. And I know you're going to be really excited to hear how Diagnotes will be contributing to that vision. Being able to achieve precision medicine, where instead of every patient receiving some broadly potentially relevant protocol, we are able to dynamically adjust in an evidence-based way treatment protocols that may be completely unique, all the way down to individual patients receiving molecules that were engineered strictly for their disease. This requires a huge amount of integration across information silos. The potential of value-based care, for anyone not from the industry, the way that $10 trillion of economic value is actually paid for today, it's glorified time and materials from a contract structure perspective. Our ability to transform from volume to value is inhibited by being able to access the underlying health information that would prove whether that value or the intended value was actually achieved. And then lastly, going back to stage two, how would we bridge the gap from stage one to stage three? Because it's a huge chasm. Well, the good news is that we can accomplish anything that we could do in stage three, in stage two, which is where we're beginning right now, by designing a research protocol in which that work would be executed. And that allows us to start to both ethically study the impact of our work and begin to validate how these stages of transformation will work. And we can move to the next slide. So it's interesting. Many parties from outside the space have the perception that blockchain technology is brand new in healthcare, or is very fringy, perhaps. Nothing could be further from the truth. As a matter of fact, large healthcare enterprises, public and private sector, have been piloting and testing and examining how to apply this new technology to their industry for, at least 4 years now. And in the public, these blockchain business networks have been announced and are well underway. Just as a quick overview, what I would call your attention to is nearly every global pharmaceutical company, the largest of them in the world, are involved in experimenting, testing, and validating different kinds of blockchain business networks. Healthcare payers in the United States are very deeply engaged in seeking how to determine how to reduce waste, fraud, and abuse, how to achieve more value for our healthcare spend, and many other examples. Some of the most exciting, the Synaptic Health Alliance, they're building on enterprise Ethereum and are the party that have architected the provider directory use case. Our colleagues in the European Union have the Innovative Medicines Initiative, with a partnership among the largest pharmaceutical companies in the world as they seek to re-engineer for the European Union a way to approach clinical trials, supply chain, and patient-mediated data exchange in a way that works for the entire European Union. These are just a couple of examples, and I hope it gives you a sense that we are perhaps much farther along in this industry than is broadly known. And with that, I would like to hand it over to, oh, I'm sorry, one more slide, apologies. So one last thing I would like to leave you with before I turn it over to my colleague at Kaleido, Sophia Lopez, is that sometimes the definition of terms can be confusing, and we talk a lot about blockchain. Something I just wanted to bring to your attention is that this entire new tech stack, it all is built on top of Web 2, today's mainstream web. And yes, it includes blockchain networks, which could be public or private and hybrid, that incorporate smart contracts, tokenized assets, and decentralized apps. But very critically, it is also the new paradigm in which we can deploy and activate privacy in-depth technologies and decentralized artificial intelligence. At Consensus Health, our thesis is that it is the convergence of these three technologies, blockchain, privacy in-depth, and decentralized AI, that ultimately has the potential to create the transformative value for our field. So with that, I'll hand it to my colleague, Sophia Lopez.
Thanks so much, Heather. I know Steve said that, acknowledged that Lana is a true luminary in the space, leading the world's leading cloud providers' efforts in blockchain for the last 5 years. I'd like to say Heather is equally a luminary in the healthcare space. We've been working together for the last 2 years. When we were at HIMSS last year, it was great to see all of her efforts leading work with the HIMSS blockchain committees, the IEEE committees, literally wrote part of the book on blockchain and healthcare. So I think we're very privileged to have her insight on healthcare use cases, where these emerging technologies can really apply to best serve healthcare and life sciences. Kaleido is all about, really our mission is about making these healthcare ecosystems, these business networks, radically simple to deploy, run, manage, and operate, and all enterprise grade. We've built Kaleido for the most highly regulated industries with the strictest levels of compliance. Of course, we work across all industries, which benefits us in terms of providing that technology platform, because we can provide all the repeatable components that any industry and any use case would want to use. But we do really have a special place in our hearts for healthcare. I've worked in the healthcare space in previous roles across the industry, and it's one where, as Heather laid out, there's a tremendous need for the sort of benefits that blockchain can bring. If we move to the next slide, what we've seen really working in the blockchain space over the last 5 years from an enterprise lens, where there are these higher levels of privacy, permissioning, and many requirements about how clients want to run and operate their resources. Moving from a POC to pilot to production was extremely difficult and slow and expensive in the early years. So this is what we really built Kaleido from the ground up to address, going from that early concept and proof, the proof of that and the business value all the way through pilot and production, and being able to start small, elastically scale, onboard new members, really removing a lot of the friction around the governance of these business networks. And as Heather laid out, the vision in healthcare of just really being able to decentralize the ownership of the data, getting that shared view of the data and transparency is something we can help clients achieve quickly at the highest standards of enterprise security, compliance, and performance and scalability. If you move to the next slide, we can see that in the healthcare space specifically, we've been working with clients from the very beginning. Just a few examples here are CDC was looking at how they could use blockchain to remodel and sort of reimagine an 18-year-old messaging system called FinMS that they use for disease surveillance. And they started with tuberculosis, but there are over 90 different disease states to apply this technology to. It just really changed the way that states and these federal and larger entities can coordinate the flow of information. And you can see just where we are today with COVID, this sort of technology and work is really more critical than I think anyone ever imagined. In terms of other use cases, Elysium is a great one, looking at providing, I'm not sure, but on my screen, I'm not seeing the main slides anymore, just an audience Q&A. So just pointing that out in case everyone else is seeing that. The Elysium network is working out of Puerto Rico and combining, sort of getting that more coordinated view of the patient across doctors and pharmacists, and trying to coordinate the care with that by creating the network on blockchain. There's also looking at solving diabetes in China by creating an industry consortium around the providers of the healthcare information, the payers, and then the life sciences players, so they get a better integrated view of the patient data. Diabetes is rapidly becoming a large problem there. A quarter of the population is either insulin resistant or actively has diabetes. So it's something that requires concerted effort and to solve, and looking with the ultimate goal of that patient self-sovereignty of the data. We've been working with a number of the people here together on some of these use cases. I think that the next, another one we want to highlight quickly was just around food safety and a shared sort of data marketplace around that and exchange of documents. And then the fifth one we were highlighting, where we're going to get to spend a lot more time, is Diagnotes. So with that, I would like to introduce Jamie, the CTO, who can tell you about what they're doing in their collaboration platform, which is leveraging blockchain technologies.
Hey, thank you, Sophia. Looks like we're bringing the slides back. All right, thanks, Trent. So my name is Jamie Kurtz, and I, as was said earlier, I'm the CTO here at Diagnotes. And what I'm going to walk through is how we are leveraging blockchain as kind of the early stages of our broader vision for how care should occur in healthcare. As Heather said earlier, there's a lot of focus on care coordination and integrations, and ultimately value-based care. And so it's our vision at Diagnotes to really, in order to improve care, we need to open it up. We need to get everybody involved in the care of you as a patient, right? So whether that's your healthcare, your general practitioners, your dentist, right, your chiropractor, and then your family, spouses, kids, parents, everybody should be involved in the care of you as a patient. And so if you think about opening up a platform, you think about opening up collaboration, blockchain is just a natural implementation and a natural tool that we can use. So we've started to do that now. Central to that vision, of course, is our mission, which is to deliver communication tools that reflect the natural habits of healthcare professionals and patients. So rather than shoehorning technology into healthcare and trying to make people and healthcare providers, healthcare professionals, and of course you as a patient, rather than make all of these people use tools that don't quite fit, we've worked with healthcare professionals very closely to design and build a platform that mirrors what they do, what they were trained to do, what they do on a daily basis, and what they ultimately want to do in order to deliver the care that they want. And so, our platform very much mirrors what people would expect today. We're a mobile-first platform. It looks and feels and smells like a mobile app that you would have on your phone today. So it doesn't have that kind of circa 1980s, 1990s feel that a lot of tools today in healthcare do. Ours is very natural, intuitive use. And finally, which is really key to our whole value proposition, we are empowering teams. So healthcare happens in teams, it really does. And that's going back to the drawing board, building a platform from the ground up that empowers teams. We're seeing a tremendous success in the industry when our clients are using our platform, because ultimately it does mirror how they behave within the the physical space within the organizations. Next slide, please. So as I mentioned, we don't shoehorn technology into how healthcare providers go about their business. So over the past several decades, we've had various pieces of technology come into the space, but we believe they have not done so all that well. And today there's a myriad of secure messaging solutions, which is sort of like iPhone messages or iMessages on steroids. But it's really all about point-to-point communication, and people end up in silos. They end up in kind of what I call communication dead ends. And so instead, what we believe, on the next slide, Trent, is that secure communication as a whole, secure messaging is something that we need to move beyond, right? So what we've done is we've built a platform that is team-focused and patient-centric, and then leverages the workflows that are already in place within healthcare to ultimately allow the professionals and the patients to collaborate and realize that value-based care. So next slide. So as I mentioned, central to the platform is this notion of teams. And so one way this is realized on the platform is this construct of a team room. And so you can imagine that in a platform such as ours, you have the ability to get everybody in the same room and collaborate on the care of a patient. These team rooms mirror very naturally what they already do in the healthcare space. So if there are any healthcare professionals on the line today, you know that you operate in teams, whether you're a team of cardiologists or you're a team of hospitality people, or you're surgeons or you're a team of residents. You always operate in teams, right? You always operate within your service line, or whatever it is, the nurse team or the rounding station. You're always part of those teams. And so we've gone a long way to recognize those teams within the platform. And then associated with that, we have things like notification pathways and escalation and on-call schedules and various things that take what's happening in real life and put it in the platform. Trent, on the next slide, you'll see that the second kind of room we have within Diagnotes, in addition to team rooms, are patient rooms. Patient rooms, similar team rooms, in that they allow communication, collaboration with other people on the platform, but they are linked directly to patient records in the EHR, right? We all know that the EHR itself is the source of truth. That's where the patient's first records are. That's where their history is, their medications, things are, observations, things going on with the patient. But the EHRs don't hold the collaboration, right? They don't hold what's actually going on around the record. And that's what Diagnotes does. And so by linking a patient room with a patient record, we allow the healthcare providers and we allow the patients themselves, right? And the patient's personal care team, family members and spouses, friends, whatnot, they can also join that patient room and collaborate on their care, right? So everybody involved in the care of a patient can get in that patient room. So now what we've got is we have team rooms and we have patient rooms, and we allow easy navigation between the two, because those are the two contexts in which professionals and honestly patients work. They work within their service lines and they work within team patients, and we can allow them to easily navigate back and forth. Next slide, please. So here's just, before I get into the blockchain part of my discussion, here is a quick screenshot of what it would look like if you were, for example, a hospitalist on our platform, and this would be a hospitalist team room. And so it looks similar to what you might see in any other messaging application. Like I said, we do mirror and reflect the sort of modern expectations when it comes to communication. But there are some things here that are unique to us, and one being that we've got orders coming in here, and we have ADTs and things that are very specific to healthcare showing up inside this room to let everybody involved in the care of that patient know what's going on, and to let everybody know what's going on within their organizational team, what's going on. You also see towards the bottom that at on call, these rooms can be linked with call schedules as well. So all I have to do as in this case, a hospitalist, is I can just tag add on call, and then all the appropriate notifications go out to who's ever on call right now that something needs to happen. So again, unlike just straight up messages or Slack or Teams, we've done a lot of integration with the systems that are already in place within the healthcare world to allow their workflows to be reflected on our platform. Next slide, please. So how does this get us to blockchain? Well, when you think about it, because as Heather talked about earlier, we do have to contend with HIPAA. We do have PHI. And so what we need to do is make sure that our platform is of utmost trustworthiness, right? And so it's not enough to just store all of that collaboration information, those communication records, and then say, you know, trust us, we've got it, right? And so what we've done in order to support the legal activities around, you know, various HIPAA incidences and events is we are taking our communication events, the records of all the communication going on the platform, and we are effectively sealing those or signing those on Kaleido. So what that does is it makes sure that everybody knows, including the legal team and compliance and everybody else involved in, you know, legal proceedings, that that data wasn't changed. And so we've got a whole new level of trustworthiness for the data that nobody else in this industry has right now. And so I'm going to take just a minute or so to kind of walk through this architecture. And then I believe after me, you're going to see a demo of Kaleido itself. So if you start at the top, the one label there, you've got kind of the backplane of events that we have in our architecture. So that's kind of all the things going on in Diagnotes. And we're able to siphon off that backplane of events into various consumers on the platform. One of those now is a small app that we've written that basically takes that communication information, creates a hash, and then sends that over to the Kaleido REST API. And then using a smart contract, we're able to store that hash on the Ethereum chain, right? And then through a subsequent asynchronous callback at the bottom there, using Kaleido's event stream feature, we get a callback back into our platform. At this point, using AWS Gateway API that includes the official blockchain signature of the event. So at this point, we've got two hashes. One is ours, and one is the one coming off of the chain. And then at the end, we store both of those down into the database. So what that effectively does is for all those events that are coming across that top backplane there, we are signing all of those using Kaleido in order to ensure the trustworthiness of that data downstream when we get into various legal proceedings and data requests and that kind of thing. So what Kaleido has done for us though is it allowed us to create an architecture that's asynchronous. It's very important in a communications platform, right? I don't want to be holding up real-time communication with things like this that you see in front of you. Because of the architecture, we can kind of buffer it up, we can trickle it out, we can catch up later. I could even shut it off and catch up later tonight if I wanted to, and everything would work great. Because of their event stream feature, I don't have to expose any direct HTTP endpoints outside of what I can do with a built-in AWS tools, which is very important for me from a security standpoint and reliability standpoint. And then last, in order to get this whole thing working, the smart contract was super simple. So all we're really doing is publishing some data onto that chain, and then we're fed back that signature back into our platform. So, you know, I spent time with my team looking at a whole myriad of options when it came to a platform such as Kaleido. And we actually spent over a year now. I started talking about this at HIMSS 2 years ago. So 2 years ago, we were working on this and went through different vendors. And Kaleido was the first one to come along where we were able to quickly drop in some new code and some new connections here you see on the left. And within a matter of a few days, we had this whole thing stood up and ready to go. And in fact, earlier this week, we rolled it out into production. So we are now live with this architecture you see in front of you. And the team at Kaleido has been great in supporting us along the way. I think the next person in line is Sophia. Do you want to take it back over here? Thank you.
Yeah, thanks so much, Jamie. Really appreciate the kind words. I'd say the most rewarding part of our jobs here at Kaleido is working with clients like you. I mean, what we want to really do is help people accelerate getting to the value of blockchain, and really so that you can provide those benefits to the patients and all the stakeholders in the particular solutions, whatever client is trying to get to the market. But that's really the fun part of the job. And it's been a pleasure working with your team so far. We wanted to get under the hood a bit with Kaleido. I think, as Jamie mentioned, he was able to get into the solution up and running on Kaleido in a matter of days. In the early days of blockchain 5 years ago, it would have taken maybe months to years, millions of dollars, lots of custom code. We learned a lot as an industry since then. What you really see is that blockchain is only 5% of the complete solution. There's a whole series of both on and off chain technologies that you really need to leverage in a plug and play fashion to be able to rapidly build these solutions. So we wanted to just give people a sort of 5 or 6 minute flavor of what it's like to actually go into the Kaleido platform and how easily you can experiment. We have a free starter tier and build out your own solution. So if we go to the next slide, we have whole webinars that dive into each layer of this, so I'm not going to spend a lot of time on it. I think it's important to say we have 40 plus services across all of these layers that data, transaction, middleware, and application that really provide the plug and play components you need to very quickly get those collaboration solutions in market, like as Jamie mentioned. And then you're able to integrate. Oftentimes, many clients have need to integrate to existing systems and sources of data. So there's a lot of plug and play components around that as well. And what's really critical is a third pillar around managing the operations of these networks, and then the both on the IT level in a DevOps fashion, but also the business governance of these networks. So if we move to the next slide, I just wanted to tee up what we're actually going to show in this demo. Heather made a great point about sort of the maturity curve, maturity cycle of a lot of these projects. We have a lot of clients, and this is an example we'll show you, who don't want to put PHI in the chain. What they want to put is a hash on the blockchain, and they want that audit record, they want the immutability, they want the transparency, they want the shared nature of that visibility of the data, but there's also information they want to keep private. So on Kaleido, we have 4 different ways to provide that privacy. We're going to showcase one of them here, which is a private document exchange, managed file transfer type technology. But there's things that going all the way up to zero knowledge proofs on our platform that you can go and find in our marketplace today. So this particular use case is one we actually see across many industries, not just healthcare, but it's obviously very applicable to healthcare. And we show just a basic a demo of that here, and it will showcase the document store capability, an on-chain registry and address book, and how you can leverage the smart contract management. You don't need Ethereum specific skills. You can just code to RESTful APIs. So any application developer can very easily be able to get up and running in production. And then event streams. So you really get the promise of the real-time exchange and visibility to this data. So I think if we dive into the demo, so what you're seeing here is a live running blockchain on Kaleido. This is our dashboard. You can see in the middle of the screen, we have 3 organizations with a node each, and those nodes are on the blockchain. There's also off-blockchain components to the right. So we have the document store component, which I mentioned, which is running off-chain, and that's part of the B2B communications bundle of capabilities we offer. So each of these organizations can have their own private document, and then they can record the transactions of those documents on-chain on a blockchain. If you actually dive into the dashboard and look in the address book and the membership details of these organizations, what's important in private blockchains and permission blockchains is knowing who you're dealing with. So you can see that this organization 1 has bound off-chain certificate, could be X509 certificate or other verification to their on-chain identity. And now they also have a way for other entities in this network to communicate them end-to-end encryption, and then they're able to retrieve this with their private keys and de-encrypt it. If we go into the actual app itself, the app is just a very simple app for demonstration purposes. This is what clients build the app, and they use our 500 plus APIs really to build that app more quickly, get to market. If we look at just exploring this data marketplace, the information that's in here now, it's a very simple example of healthcare data. It's just a doctor's information. And you could see that there's 50 entries in there, that 48 different authors have contributed. And there's also the construct of a token. And this is to help incentivize the right behaviors in this marketplace in terms of contributing, editing, publishing data, as well as being the beneficiary of downloading the data. So if organization one wants to publish data on the blockchain, they can go into their records and decide what they want to put on the blockchain. In this case, they're saying they want to advertise, they have a record around a certain doctor, and they have a unique identifier for that doctor, which would be made public. There is a lot of other information in that record, which they've collected. And in the case of a doctor, it could be, are they seeing new patients? What are their credentials? What's the current address, the phone number, the availability? So there could be a lot of rich data here that's up to date and accurate that patients would need, that this healthcare provider has. But right now, they're only publishing from their private document store. They're submitting to advertise to the marketplace. We have this entry about this doctor, and they're publishing in real time. We have the event streams capability that makes this information automatically available to everyone who's in the network. So organization one owns this data, so of course they can download it. If you look at what the organization two can see, they would be able to see that they could purchase it, they could search for it, but they actually wouldn't be able to access the information or download it itself at this point because they don't own it. So you could see that the privacy is protected of this data. They just know that the record is there. There's a hash of that there, and you could see that the blocks in the real-time dashboard are showing what's happening. If you look at the actual hex view, you could see that the only thing that's been put on the chain is recorded is the name of the doctor and that identifier itself. If you go into organization one's document store and you search for this record, you can find the record here of the doctor's file. If you go in though and you take the hash here and you want to verify, what are the views of the other people in the network? Are they able to actually access this document? And we go into the second organization and search by that same hash. You'll see that the document is not available to them at this time. So going back into the marketplace itself, organization two can decide to purchase this, and you'll see in the lower right-hand side, the token count now decreases by 10 tokens. And again, this is to incentivize the right behavior so that you're contributing to these marketplaces as well as sort of just being the beneficiary of the information. And this encourages collaboration between communities. They can now, you can see the purchase is recorded on the blockchain as a transaction. They can download it as well. If you go back into the Kaleido dashboard and you search again by that hash, the document is now available to organization two. So in terms of the final views that would want to show you, if you go into the block explorer, you can now see the more recent activity there in terms of the latest blocks, the success of the transaction. If you go back to the app itself and just looking at organization three's view, they can see the recent activity by their counterpart. They again, it's only available for them to purchase. If organization two had rated it, then they could now, that rating would now appear as well. So you have the abilities to design for ways to have the peer collaboration around rating the quality of the data as well. So very quick demo and deep dive just to show you that these technologies, they are real, they're here for you today. And we've done a lot to make blockchain very explicit, transparent. You get the insights and metrics and really demystifying these technologies and removing a lot of the need for the specialized skills that in the early days were required. So with that, Trent, I would pass it over. I'd like to introduce you to Lana, who is from AWS. I think we've done a good job of sort of diving into a particular use case And a particular example here of what you can do, working with partners such as AWS, you can actually add a lot of richness and extend all of what you're doing with machine learning, various analytics capabilities. We have lots of cloud integrations already built in, which I think Jamie has leveraged some of that for his solution as well. So Lana can walk you through their investment in the healthcare space and what they're seeing and how they can help.
Sounds great. Thank you so much. I hope you can hear me okay. My name is Lana Kalashnik. I'm a principal solutions architect focused on blockchain at AWS. So it's great to be on this webcast and share some things that we've learned working in blockchain, working with Kaleido and our customers at large. So something I wanted to touch on briefly is just overall our approach to building solutions for customers in healthcare. So as you see on the slide, we were really focused on building out the right solutions for the right types of customers. So just like with any other services or any industry approach, 90 to 95% of our roadmaps are directly driven by feedback from our customers. So some of the trends that we're seeing overall in healthcare, by talking to our customers, we're finding that over 54% of CEOs say that they want to transition from volume-based care to a value-based care. This is also exacerbated by the amounts of data that we're collecting and piping into our systems. So if we're looking at the projections of how much data we typically are looking to store in healthcare space, it is up to 163 zettabytes, which is a 10x increase from 2016. So again, it becomes really, really crucial to understand how to federate this data, how to make sure to be compliant in the way we architect solutions, and how to derive value for our customers and patients. On top of that, we are seeing innovations, blockchain being one of them, reliance on cryptographic verification, which really lets us take advantage of some of these innovations, and just the pace of innovation that does drive us to launch new solutions and approaches every 18 months or so. And something that's on top of every a CISO or every CTO right now is data breaches. So we are seeing that sophisticated security breaches are up to the frequency of, let's say, 1 a day. Clearly, those are things that should be addressed by everyone building in the space. Because of that, we're really focused on the solutions that address those needs. So specifically storage and archiving of data that is compliant and easy to use, core operations for business continuity. So making sure that all of the solutions that are architected in a highly available fashion and are globally deployable. Care coordination, and we've touched on that. So having the right tools for communication, Diagnotes is a great example of a solution provider that is doing that. Patient engagement, I've seen a couple of comments about mobile applications. So we are seeing a lot of mobile first platforms that are emerging in the space, especially around telehealth. So that there's clear correlation there with reaching customers at edge, analyzing clinical and population data, which is something we're doing right now with COVID strands to help accelerate some of the research there for vaccinations and things of that nature. But I wanted to talk a little bit more about blockchain approach. Next slide. So some of the solutions, actually, if we're looking to address some of the issues that we brought up in the previous slide, is, for example, if we're lacking resources to implement data-driven decisions. Here we can define scalable architectures that allow you to scale up or down any compute requirements. As far as extracting value insights, this is data and analytics that are directly fed by either data lakes or on-chain or off-chain data that will be stored in solutions like Kaleido. Also, making sure that we are compliant on the way we store, process, and share patient data across the board. So these are some of the trends that I will probably not dive too deeply right now because we're running out of time, but the main trends here that I want everybody to take away is really focusing on value-based care, the increasing data volume, and all of the security considerations of sharing the data that we all should keep in mind as we're building these solutions. All right, so now we really are going to talk about blockchain. So how does blockchain enable some of these solutions? So the way we approach blockchain is the same way as any other technology. So we're really listening to customers, and we found that there are two distinct types of use cases that we're seeing. The first one is ledgers with centralized trust. So there we have a central authority that manages the ledger, is charged with creating and deleting data. So no issues there. But the second use case, which is really applicable to blockchain, is transactions with decentralized trust. So some of the examples here would be peer-to-peer payments, sharing data, which is really applicable to healthcare as well. So if we're talking about pre-insurance settlements, if we're talking about supply chain, understanding your supply chain limitations, let's say, or potential issues that are 2 or 3 nodes deep in the chain is a lot harder to do without decentralization, which, as we're seeing, supply chains tend to be strained right now, or strained in a lot of geos. All right, so we've established that we do have this problem in healthcare, or a set of problems that we can solve with technology or help solve. We've established that blockchains is a great solution for any products that require decentralized trust. But then once you start building out, you'll probably notice that only about 10% of a blockchain solution is the blockchain network itself. So here it's really important to start focusing on integrations and making it an operational enterprise-ready product. I've came up with this slide a while back to really just show the amount of integrations that are possible for blockchain platforms. So here we're talking about building a really scalable solution. We really need to think about all types of users. So when you think about devices as users, so this is your sensor data, all of the machinery or instruments that need to be plugged in and communicate with these networks. These are the end users and patients of this network. And also these are other organizations that would need to be anchored to, let's say, your healthcare network and share data with the right incentives. You can see here that I purposely left the inner block with consensus, smart contract, and ledger agnostic. This is exactly where blockchain fits in. But from then on, we really need to be thinking about notification. How do we integrate with ERP systems and stay compliant? So one such example of an implementation is the Kaleido platform, which we've collaborated on over 2-3 years ago now. So it's really exciting to see the progress we've made and the new applications in healthcare that we're discovering and promoting. I'm not going to go too deeply into any customer use cases, as we've already covered that in the previous slides. So if you have any other questions as far as how AWS supports these platforms, please let us know in the chat or after the webinar. Thanks.
Thanks, Lana, and it's been great working with Lana from the very beginning. So I think, just to summarize, very privileged and honored to be here with Consensus Health, who really brings an incredible amount of domain expertise and care. I mean, their hearts are really in solving very challenging problems in the healthcare and life sciences space. So it's been a privilege collaborating with them. AWS as a partner from the very beginning, and I know a lot of the industrial grade strength and capabilities of what we offer rides on your global backbone. So we thank you every day for all of the collaboration support. And Jamie, you know, it's been a privilege having you here. I know people always want to learn about what people are doing, and I really appreciate the time and care about the business aspects of the use case as well as the technology. So we have about 5 minutes left. I know we have a number of questions in the Q&A hopper. We will try to get to as many as we can. Most of the speakers can stay past the hour as well if we need the additional time. So I don't know, Trent, were you going to moderate the questions?
Yep, happy to. So we do have a bunch of questions that came in through Q&A. The first one here is from Dennis. He asks, how will blockchain allow the development of more mobile apps and communications between providers and patients? And how can blockchain support subscription models of care like we offer?
Well, I'll jump in. Yeah, so from an architecture standpoint, I think getting everybody involved in the care of a patient is critical, right? And that was what I talked about during my section there. So I think as you open up communication, as you seek to democratize care, there's got to be a place to do it, and a blockchain type of solution I think is going to be required.
Awesome. Thanks, Jamie.
I think I'll follow on with that, a full agreement, Jamie, and just add that it's not so much about being able to create more mobile health apps. It's about how do those Web 2 mobile health apps end up being migrated to Web 3? And then what does the value proposition look like for doing that? And what that means is that today's mobile health applications really have data sets that cannot be used for the purpose of real world evidence. The integrity is too low, the level of evidence is too low, and they also are not able to integrate other patient self-sovereign data sets into the architecture of what's captured through the app itself. That's the limit. A world where we go to Web 3 and we realize the vision of patient sovereign identity and data, that means the patients will be able to facilitate the privacy preserving, ethical cross-sectional aggregation and analysis of all of those data sets. The data is behind not one app, but all of the data that they govern. So vastly higher potential scientifically from a population health perspective than we are locked into in today's Web3 world.
Awesome.
Okay, and I was just going to jump in terms of how blockchain can support the subscription models of care like you offer specifically, and we would be happy to get on a call and just talk through your solution, what you're trying to accomplish, and then how the technology platform can support, and of course from a healthcare application level as well, Consensus Health is there to help advise as well.
Awesome. All right, our next question is for Heather. So Heather, do you think we'll achieve interoperability anytime soon within the healthcare system now that the pandemic has created an urgency in supply chain realignment?
Well, first, in order to answer that, we must recognize that the term interoperability is a loaded term. It means many different things in different contexts. Blockchain does not directly impact semantic interoperability of the underlying data. So it's not a magic panacea where now, since we have blockchain in our infrastructure, our data is now semantically interoperable. Regardless of how you secure it, how you exchange it, how you move it, it still must be semantically interoperable, either through manual processes or perhaps as a result of AI functions, AI-driven or automated transformations of that data. However, we do have a woke Earth in the sense that all of the pre-existing systemic weaknesses and vulnerabilities in our healthcare delivery system broadly are now laid bare, impacting all of us. So I think that while those of us in the industry may have been working on these same problems for a long, long time, there is now a new sense of demand that these things be resolved. And so interoperability of the semantic data layer and how we achieve that has a new level of prioritization. It also means cross-chain interoperability for blockchain ecosystems. And in our industry particularly, our whole industry has post-traumatic stress disorder with respect to vendor lock-in because of the experience with EHR systems, and what's happened in the last 20 years. So as we're looking at new paradigms of technology with blockchain infrastructures like AWS, Kaleido, Diagnotes, and Consensus Health are all part of creating different aspects of those networks. we have to recognize that being able to address concerns about vendor lock-in is on the critical path to adoption. As our industry does not want to see those same paradigms repeated in our new models. So we have a responsibility and an accountability to drive interoperability, and our team shares those values. All of us here on the line share those values. You know, if it's AWS thinking about cross-cloud, if it's Diagnotes thinking about how it might be able to interact with lots of different underlying infrastructures, and Kaleido has a very open systems point of view, as does Consensus Health.
Awesome. Awesome. I know we're a couple minutes past the hour here, but maybe we can squeeze in one or two more questions. So here's a question. I'm not quite sure who to direct it to, but can you elaborate on the differences between business, physical, and transactional decentralization is relevant to healthcare and the integration with legacy systems?
I was wondering, Steve, if you wanted to take that one?
Sure. So for folks who aren't familiar, this is a series of blogs that Kaleido has written about, just how confusing the topic of decentralization is at large, and how there actually are three completely distinct types of decentralization: physical, business, and transactional. So for more details, check out the blog and also stay tuned for the ongoing series there. Particularly, that concept applies to all industries, and to the question, it does apply in the healthcare space. I think it's important to remember that today, systems are actually very decentralized. That's one of the shocking secrets in this space. We talk about decentralization like we want to get there, but actually we have a very fragmented system today. What we want is some of the benefits of from efficiency standpoint of centralization, without the bad aspects of centralization, where there's a single party that's really has more control than we want them to have. And that's really the fit, the killer use case, if you will, for enterprise blockchain. It gives you the ability to maintain those different kinds of decentralization. And there are different knobs and dials when you get into the details. So you can really tune that and parameterize it depending on the specific needs. And I don't think in the healthcare space it's as simple as one blanket fit. There's a wide variety of use cases with different levels of sensitivity of data and so on. So I think decentralization really, as a concept, fits well into the healthcare space, into some of the most urgent needs. But I think it does bear understanding these different kinds of decentralization. And it's not sort of a blanket panacea, but understanding how these different types fit in and are appropriate for the specific use case.
Awesome. Thanks, Steve. Maybe we got time for one more question.
Hey, Trent, I was thinking, since we have Jamie here, someone wanted more details on steps 1 through 7 in Diagnotes solution architecture. And I knew that we would have a lot of interest in that. But maybe that would be a good one to close out with, just because it's always helpful to have someone step you through versus just see a slide.
Sure, yeah. Trent, would you mind showing the slide again?
I will, as soon as I can.
And Jamie, as you do that, there are several questions related to that. Another one is where the patient EMR sits.
Yeah, I can talk about that. Yep, and while he's trying to find that slide, if anybody has additional questions, feel free to hit me up on LinkedIn. I'm more than happy to hop on a call and talk through it. Did you find it, Trent?
My Zoom or my Google Chrome has crashed, so I'm trying to get it up here.
Good timing.
Yeah.
No live events can occur without at least one kind of of system error somewhere in the mix. It's cool.
All right, I think I can share it, Trent. I've got it.
All right, cool, thank you. So, so somebody wanted me to describe basically the steps involved there. So, and as also the EHR integration. So if you can imagine, number one at the top is, as I said, kind of the backplane of all things occurring on Diagnotes. So we have a very event-based architecture. So you could look at that as maybe an event bus or an event stream, some kind of construct that all of the things are happening. And that includes, by the way, the things happening from the EHR. So we have different ways of pulling information or receiving information from the EHRs. So if you're on the call and you understand how the EHRs work, there's HL7 type things, and there's FHIR. There's just straight old FTP and CSV file uploads. There's various ways to ingest that information. But all of those for us kind of fall into that backplane of kind of overall what's going on in the system. So going down to number two, we've built a very small app. In fact, I think the developers did it in a matter of a day or two. That essentially is a consumer, one of many consumers for the events that are coming across there. So that could be, as somebody pointed out, something that happens in the EHR. Largely, it's what's going on Diagnotes itself. Like I said, we're a mobile-first platform, and so most of the users are in the app and they're collaborating with each other on the platform. And so number two is basically ingesting, consuming those events in this new app we wrote. And the first thing we do is we create a signature or a hash of that event. So if it's a message somebody sent, we take who said it, when they said it, and what they said, and we hash that, and we essentially create a signature for that event and time. And so that just becomes a block of text that we then send over to, and number four, over to Kaleido. One of the strengths that we saw right away on the Kaleido platform is being able to stand up very quickly a REST API. So I've got a bunch of modern developers. They want to use modern tools. They're not interested in slinging files around and doing TCP connections and whatnot, like happens in healthcare most of the time, right? And so they can very easily make RESTful API calls over to Kaleido. Then what you do on the Kaleido side is you register what they call an event stream that is a callback back to our platform. And because we're on AWS, and because AWS offers you the ability to stand up an API, like a single endpoint, single resource, very quickly, and Kaleido can already integrate with that endpoint on AWS. It's called Gateway API. We stood that up and we fed the Gateway API call through number 5 straight into another queue, number 6, at which point that app that we wrote consumes that secondary queue of all the callbacks coming back from Kaleido. So if you look at number 4, number 5, number 4 is us sending our hash to Kaleido. 5 is its callback to us. It goes back into a queue, and that same app, which was at not a stop sign, but whatever that is, a 6-sided agon of some kind, is essentially reading off both these queues. It's the events in the system, and it's the signatures coming back from Kaleido, marrying those two up and sending that down into the database.
I wanted to take a quick note here and just tie two concepts together as far as the growing amount of data, right? So we're having these tons of different data sources that are being pumped into your accounts, into your storage. And by using hashes, which we were talking over and over again, we can use cryptographic verification to attest to integrity and correctness of terabytes worth of data with a really cheap hash comparison. So we don't need to dig through the logs, through audit logs, through access logs. We can submit a simple hash that will mathematically prove that we are compliant or not compliant, which is a really, really powerful concept to take away from this architecture.
Yeah, thanks, Lana. And in addition to that, the hash also, and the way we're doing it, gives us the ability to avoid PHI being slung around. So the data that we're hashing is purely known to us. It's not identifiable. You couldn't even use any kind of pattern recognition on the hashes to conclude anything about the data. So we're taking that blob of information, creating that fixed size signature and sending it over. So that also avoids, like I said, PHI being thrown around and into Kaleido and whatnot.
Jamie and Lana, just weaving in one additional question on this around AWS systems and specs and just the scalability overall of this platform. These icons are actually different AWS services. Everyone might not be familiar with those, but maybe
yes, thank you. They are.
touch a little bit on that aspect.
Yeah, so the top there, we use a pub sub system between SNS and SQS internally. So that's our overall system. We get a tremendous amount of throughput, and kind of the sky is the limit as far as how many events we can show through that system. And then between 5 and 6, you see two icons there. One is Gateway API I mentioned, which is the ability to stand up an API endpoint, HTTP endpoint, and receive callback straight from Kaleido, because they could already integrate with API or Gateway API. And then we feed that directly into a queue so that then we can consume that at will, right? So one of the benefits of this architecture is I'm not standing up a new HTTP endpoint that's live and has to be secured, has to be running all the time. Using the AWS bits in number 1 and between 5 and 6, I'm basically shielding myself from the outside world, which is, from an architecture standpoint, is very comforting. I sleep a lot better at night with this architecture, with the AWS pieces in there, versus having real-time endpoints stood up at the EHR side with the users, of course, or with the callbacks from Kaleido.
So one thing I wanted to drop in here, and I'm going to steal it from Peter, but what I really love here is that we're actually coupling that with the messaging service in Kaleido that is based on Kafka. So here we're taking care of serialization, of retries, of all of the stuff that might slow you down as you're persisting your data on chain. So we've kind of designed the systems to interoperate, and it's really cool to see that in your architecture, Jamie. So thanks.
Yes, thank you. Yep. Like I said, if that doesn't answer all your questions and you're interested in more details, feel free to hit me up on LinkedIn.
Okay.
Was that it?
That was supposed to be the last one. I don't know if we should continue or not. I think there's still about 30 people online. So, but I haven't had a chance to scan through the other questions since I was sharing.
There's a couple of questions around economic incentives and how they're built into the platforms. We touched on this at a couple of levels. Heather and or Jamie, just sort of from the application level itself, and then sitting underneath that, obviously blockchain gives us tokens and tokenization. So maybe Sophia, you could touch on it at that layer.
Yeah, I think, well, we showed a simple, I guess, example of that just in the case of preventing the tragedy of the commons. So a very common use case in, sort of the early days of people are saying, we don't want to put PHI in the chain, we want to put a hash, but there is shared data that we would have a lot of benefit as participants if we could just collaborate instead of, as Steve mentioned a minute ago, keeping everything in a very fragmented, siloed sort of our own database, and then we're trying to reconcile, and there's just all these inefficiencies and waste, and patients not connecting with the providers, people not getting the right care. So how, if some of the, larger healthcare systems say, hey, we're going to step up and we're going to sort of open up our book of business and share all of this data about our patients, which is, it's hard for them to do. They have to run a business, and this is why the data blocking rules are in place, because there's incentives for people to hold on to the data. So how do we get people to share the data that makes sense to share, because it provides better care? It provides that shared visibility that gets, to everyone's goals. Well, a lot of times, a token construct can help, because when you're sharing, then you also have access to more. When you're editing, you're getting more back. If you're not contributing, then you can't participate in this data marketplace. So, that was the example we gave. But certainly, we see, the token construct is used in many ways across industries. And there's a sort of non-fungible aspect of the tokens where now you can sort of uniquely tie, if you have a certain sort of rebate or an incentive that's given to an individual as part of the system, you don't have the fraud or waste that you would have like with sort of a digital space around, duplication, like of a coupon, in the retail space. We see people using blockchain tokens to be able to deliver in ad tech more value and eliminate a lot of that digital fraud. There's incentives where now you're creating different types of rewards, and again the tokens could be attached more to like collectibles. So when you're in the healthcare space, it can often we often look at B2B type solutions, bringing providers and payers, employers together. But then, as you're building solutions out and actually touch the consumer, I do think the tokenized incentives can become even more and more important as we want patients to take responsibility for their health, the sort of self-quantified self. They're getting more data, but how can you sort of gamify the system so that people are really incented? And it's great to see that these mechanisms are just built right into the blockchain protocols. But I'm sure Heather and Jamie have a lot more ideas on this topic.
Yeah, Heather, maybe tying that tokenization back to how you see business models evolving in healthcare.
Sure, absolutely. So Sophia, you hit it on the head in articulating that this stack of technology creates the possibility that for the first time in human history, we could develop a hypothesis about how a particular incentive is misaligned. We could say, well, we see this misalignment and we think this is what's wrong with it. And then we have now the tools to be able to put that hypothesis to the test, and then to determine whether in fact the new incentive structure that we just designed produced the outcomes that we wish. It's incredibly important that we remember that we're dealing with a highly complex adaptive system. These incentives are interconnected all over the place, but when we describe misalignment, we typically do it in bilateral ways. This party is misaligned with that party. Well, in a future state where we are using this technology to its fullest potential, which, to be clear, no one has yet designed and implemented a working cryptoeconomic system that delivers on healthcare endpoints at scale. That is still ahead. We are all here because we are inspired by that set of possibilities. But in this future state, the stakeholder misalignments and the economic systems that we model are going to be not bilateral relationships, but vastly multilateral economic systems where we can observe what's broken, develop a hypothesis, put it in place with a cryptoeconomic system, model it in real time, and adapt it continuously until we achieve the desired outcome from the complex system. This is unprecedented in human history. And when you apply artificial intelligence to the classic optimization scenario that we're describing, we have before us the potential of finally resolving misaligned incentives in a way that, honestly couldn't be done with human intelligence alone. So it's a very, very promising time, and we are right at an inflection point of massive change and a positive, ethically intentional outcome in what we create.
Yeah, I guess I'll just add one last thought. There's been a lot of talk in recent years of how businesses are looking to move to platform models and platform businesses. And now instead of moving to end-sided marketplaces and the way you balance supply and demand. So this is just a tool to accomplish that. I think just raising it even higher than the healthcare space. This is something all industries are looking at doing. And that's part of these industry ecosystems that are coming together, are looking to build these platform models. The token construct is a very useful incentive for that.
Okay, I think we'll cut it there. And you can, if there's any other burning questions, let's take it to social media. You guys can find us pretty easily there. Just by way of wrapping up, thank you all for attending and for hanging on for the extra now 20 minutes. I thought it was a great discussion. Just to end where I started with the intro, very timely as well. We just see digital transformation accelerating in the healthcare space. And thank you very much to Lana from AWS and Jamie from Diagnotes and Heather from Consensus Health, and so our very own Sophia from Kaleido. This was a lot of fun. The slides are going to be available as well as the recording for this coming into your inbox, and we hope to see you back again soon on another webinar. Bye for now, everyone.
Bye-bye.
Thank you.